Self-care. How to protect yourself from spreading of coronavirus disease. If you feel sick, you should rest, drink plenty of water, and eat nutritious food. Stay in a separate room from other family members, and use a dedicated bathroom if possible. Clean and disinfect frequently touched surfaces. Everyone should keep a healthy lifestyle at home. Maintain a healthy diet, sleep, stay active, and make social contact with loved ones through the phone or internet. Children need extra love and attention from adults during difficult times. Keep to regular routines and schedules as much as possible. It is normal to feel sad, stressed, or confused during a crisis. Talking to people you trust, such as friends and family, can help. If you feel overwhelmed, talk to a health worker or counselor. Self-protection. For most of the general public, wearing a face mask offers very little protection from coronavirus, even if supplies of surgical. This is because air breathed in tends to take the path of least resistance. Surgical masks are not closely fitted, so most air travels round the edges of the mask rather than through it. They therefore only protect against large droplets, not small, airborne particles. Following social distancing and hand-washing guidelines is more effective than wearing a mask. Large droplets are highly unlikely to spread more than 2 meters. Wearing a face mask might also make you more likely to touch your face because they are uncomfortable or affecting your breathing. Face masks can offer a false sense of security, making you think you're protected against coronavirus and so more willing to take risks. Most people don't know how to put on, wear, take off, or dispose of face masks effectively. This means they could expose themselves to the virus when putting the mask on or taking it off. Cloth masks are, relatively speaking, extremely ineffective at preventing virus getting through to the nose and mouth. The argument for wearing these to protect yourself against infection are even less compelling. Up to 90% of particles penetrate cloth masks. Once damp, after you've been breathing while wearing one for more than a few minutes, they may actually retain virus on their surfaces. The European Centre for Disease Control states common fabric cloth masks are not considered protective against respiratory viruses and their use should not be encouraged. Protecting others. The main reason for members of the public wearing masks, particularly non-surgical masks, would be to reduce the risk of passing coronavirus to someone else. That's why the German government are telling people to use masks when they go out, as people who are asymptomatic or pre-symptomatic might not realize they are infected and spreading the virus. In the Philippines, there hasn't been any change in the guidance. If you have any symptoms of a new, continuous cough or a temperature, you should stay at home and self-isolate for 7 days. Anyone in your household should self-isolate for 14 days or 7 days from the onset of their own symptoms. A recent study shows many people test positive for coronavirus before they develop symptoms. Another suggests people may be infectious for over 2 days before symptoms begin. However, the majority of the time period during which people are infectious is in the first week after developing symptoms. Anyone with symptoms should self-isolate immediately. But in addition, we should all be following social distancing measures to reduce our risk of infection. This means always staying at least 2 meters from people outside of your household and washing your hands frequently. You should make sure to cover your mouth and nose when you cough or sneeze and avoid touching your face, nose, eyes and mouth. These measures are crucial in stopping the spread. So if you choose to wear a mask, it should be as well as following these rules. Wearing a mask doesn't mean you can take more risks or increase your contact with others. How to wear a face mask safely. If you decide to wear a face mask, special measures need to be taken to avoid contamination. Number 1. The face mask should cover the face from the bridge of the nose to the chin. Number 2. Wash your hands for 20 seconds with soap and water or use hand sanitizer before putting on or taking off a face mask. Number 3. Remove it from behind and avoid touching the front of the mask. Number 4. Dispose of the face mask safely and wash your hands or apply hand sanitizer if it is disposable. Number 5. If the mask is reusable, wash the mask as soon as possible after use, using normal detergent at 60 degrees Celsius. Wash your hands or apply sanitizer as soon as possible after touching the mask. Patient.info. Are picks for COVID-19. Do you need to wear a mask to avoid coronavirus? Thanks for watching. LG Motivated Life Channel.